Hello, good evening, everyone. I'm very opportune to be giving this lecture, and I'm glad to be associated with every one of you. And to start with, the Itsekiri Nation is a strong one, and the bond we share as Itsekiri, I don't think there's any other tribe that has that kind of bond.
Doctor, yeah, sorry, before you continue, Doctor, when you about me?
My topic today is a healthier Itsekiri.
Hello, Doctor. Can you hear me? Yeah, we're getting an echo here. I don't know if there's another phone right by you, so you can just mute that so you can help us hear you clearly, sir.
Can you hear me better now?
Thank you very much. Yes, you can continue.
All right. So, like I said, the topic of my discussion today is a healthier Itsekiri nation. Modern care for everyone, everywhere. Now, the vision of a healthy Itsekiri nation. To start with, we should know what health is all about. And by definition, health is a state of a mental, physical, social, and a spiritual well-being. So all these four parameters needs to be put in place for an individual to say he's healthy. And health is the foundation of prosperity. For the Itsekiri people, true development cannot be separated from the well-being of our people, be it the men, the women, or the children. A healthier Itsekiri nation is one where modern quality healthcare is not a privilege for a few, but it is a right for everyone in Nigeria or in diaspora, whether in Warri, Koko, or in the creeks villages. Now, modern care actually is one that can and also affordable. And the modern healthcare means access to safe, evidence-based medical services. Starting from primary healthcare centers, is strengthened to deliver routine services. Now, we'll talk about both clinics and mobile health units for the riverine area. When we talk about healthcare generally, most times the urban areas have some level of access, but in the riverine areas, there is paucity of access to healthcare. And that is one of the reasons we are also having this discussion. Both clinics, mobile health units are essential for one to carry health services from one area to another in the riverine places. Also, technology and telemedicine to bridge gaps between the rural dwellers and the specialist doctors. Now, in my village, as an Itsekiri man, we come from multiple villages. From where your father comes from, it's your village. Where your mother comes from, it's also your village, and the likes. I'm from Japa and as well from Oboro. Now, in Oboro community, we have a cottage hospital there where we have doctors and nurses who come in maybe 2 weeks in and 2 weeks out to deliver some level of care to our people, and those, not just those in the community, but those all around. And we've been able to also assist this doctor one way or the other with some mild form of telemedicine using social media and WhatsApp services and the others. And it has actually gone a long way in reaching our people. Quite a number of our people have various ailments. Initially, we talked about the primary health care for them, which is the basic thing they need to have. But in some situations, they can have some secondary, some disease conditions that need secondary care or even tertiary care. And where we are able to communicate with the medical officers, the health providers in the community, we also help in taking fast decisions in referring these patients to centers where they can get higher level of care. Don't forget, doctors are the ones who know when to refer a patient. So having a way to communicate or to discuss and reason with our healthcare personnel in the riverine areas is of utmost importance. Now, health financing models, insurance and subsidies that prevent families from being pushed into poverty because of medical bills. Now, in Nigeria, one way or the other, we are tilting into healthcare insurance policies. Unlike in the Western world, in the US, Almost everybody has some level of insurance, healthcare insurance. But like I said, almost not all. Because when I was in Dallas for some form of training, I actually met a couple of American citizens who are not on insurance, and they were not able to fund their care. So healthcare generally is expensive worldwide. It's not just in Nigeria alone. Everywhere, healthcare is expensive. So every individual needs some level of support in terms of having proper insurance to take care of their health. I know some time ago, Ogame there was an initiative that was brought out to have some kind of health insurance policy for Itsekiri indigenes. And I think that is already in action. I know some Itsekiri indigenes who are on this program, they are receiving care, okay, based on IGR, HMOs, and some other form of HMOs they have. So that is already in the process, and it's something that was commended and also encouraged. Now, the power of prevention. You know, in medicine, generally we say prevention is better than cure. Because when you have the habit of wanting to prevent disaster from coming, okay, it costs you less. While modern hospitals and equipment are important, prevention remains the smartest investment. Vaccination campaigns to protect children and adults from preventable diseases like yellow fever, measles, hepatitis, and polio. Health education is also key. It's very important. And this is something that should be introduced into school, churches, markets, and on all areas of our community. Health education on hygiene, nutrition, safe water, and lifestyle. And screening programs for hypertension, diabetes, and cancer is also very important. And these are things that should be done, on a regular basis in our communities, because early detection saves lives and actually costs less. Community sanitation and clean water initiatives to reduce malaria, typhoid, and cholera. Like I said earlier, prevention is cheaper, it is easier, and more effective than cure. Now, in some of our communities, we have some schools, primary schools, and some of our communities have actually developed to the extent that they now have secondary schools and they've even graduated some set of students. In my community, also, Oboro, Chakwa, we also have some primary schools there. Now, from time to time, we've tried to organize some health talks in these schools so that these children at the early age, they can start learning to know what hygiene is all about, learning to know how to take care of themselves health-wise. Because when you have this as your basics, when you have this as your foundation, it also helps you while you develop for you to live a healthy lifestyle. And in the long run, you become a more healthier person. So these are things that we should actually encourage. Now, health equity means no Itsekiri child should be left behind because of geography, poverty, or ignorance. In terms of ignorance, that's how we're talking about education. In terms of poverty, we're talking about them wanting to have some level of healthcare insurance to support the people. I know there are some well-meaning Itsekiri individuals who take healthcare very seriously. They sponsor their people in terms of health, okay, and trying to create jobs for them to also be able to make some little money to also take care of their health. Such activities are going on, but like I said, we need more. Now, in terms of geography, coming out with both clinics, okay, and both ambulances in our riverine areas will help in going into the creeks, places where one cannot reach easily. But with the both clinic, you can actually move the clinic to the community, give them treatment, be there for some time, and then you move to the other community. And as such, healthcare can move around at different levels into different communities. The rural communities deserve the same health opportunity. Factory workers and traders deserve workplace health programs, including hepatitis training and vaccination. The elderly and vulnerable groups, the elderly and the children especially, must be supported with regular checkups and social health programs. a call for action because the economy of a nation actually depends on a healthy workforce. So it is important that the citizens of a nation, the Itsekiri people need to have quality health. A healthier Itsekiri nation requires partnership. The government must invest in infrastructure and policies. And this is where we must also cry out, okay, that the government is also needs to give some level of support to our communities. The community must embrace healthy practices. I know different communities have management committees, they have the trust. And I would encourage that even in the trust, there should be committees that takes care of environmental sanitation. There should be committees that encourage healthy lifestyle practices in our communities. So not just to have the trust and have the skills there, they should form committees that will actually, look into the health and the lifestyle of our people. NGOs and private sectors must support outreach and preventive programs. I know the Running Map of Foundation has been doing well, especially in Japa, Ubenge, and Oge communities, where they supply some drugs. They have dispensaries there so that the people will have access to some medications for minor ailments. Now, these efforts might look small, okay, but they go a long way into helping our people. There's a book called The Atomic Habits, where tiny changes give remarkable results. So come in and give the little change we can impact in our society. Mind you, little positive change we can impact in our society, and you'll be amazed at the enormous development and change it can bring to our people. Also, talking about the private sectors, there are some well-meaning Itsekiri people who have gone out of their way, to provide service, healthcare service to our people. I know of one Honorable Godwin Ebosa in Oboro. They arranged a cottage hospital there where the people of the riverine area have as a center where they can get some level of quality care. So we need to encourage some of these activities. Every individual must take responsibility for lifestyle change choices. We must take responsibility for our people. We have to take responsibility for ourselves. We should not just sit down and wait for magic to come from somewhere. Even while we're trying to seek for assistance, we should stand and take responsibility for ourselves and for our people. Now, when prevention is prioritized, modern care actually becomes sustainable. When care is made accessible everywhere, our people can actually thrive. This is a picture of one of the cottage hospitals in our riverine area. It delivers service to the people in the riverine area there. That's the hospital. Those are some of the nurses and staff we have there. We have a few registered nurses, some nurse assistants, there's some doctors and some lab technicians who come in to also help make the place run. This is a dispensary, I think, at the Bemigho community under Running Map Foundation, where some drugs are actually provided and the indigents are able to, they have access to some medications to take care of their minor illnesses. This was an activity being carried out in Japa Health Education and Awareness Program. Now, in conclusion, ladies and gentlemen, distinguished guests, and my fellow brothers and sisters of the Itsekiri nation, we have spoken today about health, not just as the absence of disease, but as a true foundation of prosperity, dignity, and progress. The journey towards the healthier Itsekiri nation is not a dream too far. It is a responsibility we must all share. We can transform Itsekiri we can transform healthcare from a privilege into a right, from a distant hope into a daily reality. Let us live here with a shared conviction that the healthier Itsekiri nation is possible, and it begins with us today and not tomorrow. Thank you very much for your time. Ebide Mukia Bando, that's my contact details there. Thank you once again. there with us. Okay.
Thank you very much, Doctor. And we have
Anya.
we have
Anya.
we have room for two questions. Please do not forget to state your name and where you are from when you're answering your question, asking your question. We have one here